everyone, my name is Mikey Manuel.
And I'm Cesar. And this is
MT News.
Ayon sa mga otoridad, may outbreak ng scarlet fever sa China at Hong Kong. Sa Hong Kong, bata ang namatay sanhi nito at aabot na sa 494 ang kaso. Cara David na katutok, 24 oras.
Hey partner, what's scarlet fever?
I really have no idea right now, but we have Ezra on the field to interview Dr. Antara. Ezra?
Good morning. We're today in the office of Dr. Kantara, interviewing her the new discovered disease, scarlet fever. So, Doc, what's scarlet fever?
Fever is a disease caused by a toxin released by a Streptococcus pyogenes.
Where can you possibly acquire the disease?
People can acquire the disease by breathing in the bacteria and airborne droplets that come from an infected individual.
What's the signs and symptoms of the disease?
Signs and symptoms generally appear about 1 to 4 days after initial infection. The first symptoms are usually a very sore or a red throat, sometimes with white or yellowish patches. Fever of 101 Fahrenheit or higher, frequently with chills, and it has a 12 to 48 hours later the rash will appear.
So, doctors, is there any risk factor of the disease?
A risk factor is something which increases the likelihood of developing a condition or disease. For example, obesity significantly raises the risk of developing diabetes. For children who has a diabetes aged from 5 to 15 years old, have a higher risk of developing scarlet fever compared to other people.
Is there any treatment of the disease, Doc?
According to the National Health Service, in UK, the majority of mild cases of scarlet fever resolve themselves within a week without treatment. But the NHS advises people to get treatment anyway, as this will accelerate recovery and reduce the risk of complications. Patients generally recover about 4 to 5 days after treatment begins. You can use antibiotics, 10 days course of antibiotics, the most common treatment for scarlet fever. Patients who are allergic to penicillin or oral penicillin, promycin instead. Patients are advised to stay at home during the course of the antibiotic treatment.
Is there any possible complications of the disease scarlet fever?
In the majority of cases, there are no complications. If any occur, they may include ear infection, including otitis media, pneumonia, throat abscesses, a pus-filled sac in the throat, and sinusitis, inflammation of the kidney, and rheumatic fever.
So, Doc, we all know that prevention is better than cure. So, is there any prevention of scarlet fever?
The best prevention strategies for scarlet fever, as with highly infectious diseases, are, of course, isolation. Keep the patient away from other people and keep the child away from school. And of course, never forget to cover your mouth or nose when coughing or sneezing.
Thank you very much, Doc.
And that was Ezra with Dr. Antara. Thank you, Ezra.
But partner, I'm wondering where does name scarlet fever come from?
Oh, well, I don't have the answer to that question, but I know someone who does. Miss Dasun?
Do you know that the scarlet fever comes from the illness itself? Scarlet means red. It looks like you're blushing all over.
Do you know that the scarlet fever is a widespread and serious
during 19th century. 3,668 persons have died during that time. Scarlet fever is also known as scarlatina. Scarlet fever is discovered by Thomas Sydenham during 19th century because it's so epidemic.
Thank you, Miss Dasun, for your knowledgeable information.
And that's all about scarlet fever. Thank you for watching us, and this is
MT
News. Have a good day.
Let's just be friends.
Enjoy Tropicana Twister with real juice and real pulp sacks.
Friend.
When you drink good, you feel good. Tropicana Twister. It's all good.
완전 진짜 화가 많이 나지.
Mauutal ka sa intense Korean anghang ng Lucky Me Supreme Jampong.
럭키미 스프림 짬뽕에서 한국의 완전 매운맛을 느껴보세요.